Okay, for those of you who are coming in, we're just going to give folks another minute to arrive. Okay. Hi, I'm Heather. I'm the president of the League of Women Voters of Seattle King County, and it's my pleasure to welcome you to tonight's forum. This is the third in a series of League forums on policing. We began the series after the League of Women Voters of Washington endorsed I-940, De-Escalate Washington, which was intended to improve officer training and reduce police use of force. Over the last 2 years, Washington's continued to pass new laws with those goals in mind. And so we're hosting this forum tonight to continue to explore that topic because we believe it's important to monitor the laws that we've endorsed. So moderating tonight's forum is Amy Radel of KUOW, and we are so pleased to have you, Amy. Go ahead and take it away.
Great, thank you so much. I want to thank the League of Women Voters for bringing together this panel. It's certainly timely to focus on de-escalation and the new legislation. I've been covering it in my reporting, and I really look forward to learning from all of you on the panel and getting your perspectives and updates tonight. So thank you so much. I want to let the panelists introduce themselves before we start. So I'll go alphabetical in terms of last name. So Monica Alexander, would you like to introduce yourself to start?
Sure. I'm Monica Alexander, and I'm the Executive Director of the Criminal Justice Training Commission.
Great. Leslie Cushman.
Thank you. I'm Leslie Cushman. I was a citizen sponsor of I-940. I'm a member of Washington Coalition for Police Accountability. I've been working on these issues since around 2015.
And we have Representative Roger Goodman with us.
There, you're on mute is going to be the byline of the pandemic here. Good evening. I'm Roger Goodman. I'm a state representative from the 45th Legislative District, the suburbs to the east of Seattle, in my 16th year now in the legislature. I chair the House Public Safety Committee with jurisdiction over the criminal legal system. I've been intimately involved in this issue of police use of force, police accountability, de-escalation, and police community relations.
Sonia Joseph, welcome.
Hello, I'm Sonia Joseph. I'm an impacted family member. My son, Giovanni Joseph McDade, was killed in the city of Kent, June 24th, 2017. I'm also an advocate for social justice and police reform. And I'm a member of Not This Time and Washington Coalition on Police Accountability.
Chief Rafael Padilla.
Good evening, everybody. It's a pleasure to be here. Thanks for having me. I'm Rafael Padilla, Chief of Police for the City of Kent. I'm also on the executive board for the Washington Association of Sheriffs and Police Chiefs, the King County Association of Chiefs and Sheriff, and the Valley Cities Chiefs. So pleasure to be here tonight.
And Jan Tokumoto.
Good evening. I'm Jan Tokumoto, and I'm the Chief Operating Officer at Frontier Behavioral Health. We are the largest provider of behavioral health services in Eastern Washington.
I have some questions for the panel members, and then we will take Q&A from the audience. So you can submit your questions through the Q&A here on our Zoom call. And if you want closed captions, you can also see this on YouTube, and that will have the captions for our discussion tonight. So I'd like to back up to start before some of the most recent legislation that took effect this summer and was passed this spring. De-escalation has been a topic in Washington state for several years. And Leslie Cushman, as you mentioned, you were a citizen sponsor for I-940, which voters passed in 2018. And then you also worked on further legislation and rulemaking. When the dust cleared from all of those efforts, how much more de-escalation did you see taking place in Washington? What was the impact of that initial work?
Thank you for that question. So the voters of Washington state, all over the state, we had yes voters for I-940 with over 60% of the, just about 60% of the vote. And as you know, it addressed a number of issues. And the topic had been before the legislature. And what I think is significant about I-940 is that the people brought it forward, they took it to the legislature, and then they voted on it. And without that momentum, I don't think we'd have the appetite or the environment for the changes that we saw this year. What we have seen from the changes in I-940, it changed the criminal standard for the standard for criminal liability. It added de-escalation training, mental health training, required first aid be rendered at the scene. And it one of its remarkable pieces it's overlooked is it required community stakeholders to be engaged and involved. And that has changed all work across many, many areas. We have data now that shows reduction in police killings is cut in half from before 940 was enacted. Over 50% reduction for the deaths. And I assume, I don't know for sure, but the injuries are also reduced. So that's significant, it's measurable, it's real, and we're really proud of that work.
And Chief Padilla, I know you're also on the executive board for the Washington Association of Sheriffs and Police Chiefs, which is one of the organizations that's also been part of these efforts. Can you talk about the how law enforcement engaged on I-940 and the legislation that followed that?
Yeah, there was a lot of work done initially. Credit to everybody, many people here tonight, especially Leslie, in working to develop the rules and the follow on with the training and whatnot. Law enforcement got to work right away. I think you saw some considerable work in terms of policies and training that came. State training, which I'll let Monica talk to, Director Alexander talk to. But the biggest thing I think that you saw was it was a clear indication that we needed to look at our cultural issues, right? Were we doing the things to bring about the use of time, distance, cover, communication, and that really got the ball rolling. And it's been a strong, almost 3-year effort now. And I think you've seen some incredible changes coming about. I mean, Leslie noted the death statistic. I will tell you that we are seeing similar patterns in terms of use of force and things of that nature. So the outcomes that were intended in terms of reducing those types of contacts is being realized. So I think the work's been done very well.
And Director Alexander, can you talk about how the commission and the academy, their role in directly after I-940 and that legislation, what kinds of things were they doing?
So what I can tell you is directly after I-940, I was not at the commission. I was still at the Washington State Patrol. When I came to the commission, they were at the tail end of making the rules. And it was kind of interesting because I was on the legislative use of deadly force task force when all the conversations started, and Leslie sat in the audience for a long time. And, then shortly after is when I-940 came into place. And then as Representative Goodman mentioned, 3003. And then, so I've watched the evolution of this, and now being at the Criminal Justice Training Commission, where so much work was done by Sue Rahr and Leslie and a lot of the community members and other law enforcement partners, it was clearly, by the time I got there, there had been a lot of tears shed, bloodshed, frustration, and they had come together. So I was I felt like I was very fortunate to watch that whole process. And now all of the implementation and the training that goes on at CJTC is pretty remarkable, because I think almost Chief Padilla and Leslie have already spoken, and you read something, or someone read something earlier about the distance and shielding, giving time for officers to make better decisions. And that was in 1310, but that conversation started a while back. And I do believe we can attribute, the decline in deaths to that, because often officers run into danger and then they have to respond to it. But if we can teach, and we are teaching, slow that process down a little bit so that you have time to make a better decision, people have time to make better decisions, and everybody goes home safe. So it has been, it's quite an honor to be at CJTC at this time. It's a lot of work, it's a lot going on, but I'm enjoying the process.
And I'm about to turn to some of the new legislation and that stage, but I'd like to ask Jan first. Can you describe your work, what Frontier does, and the kinds of new responses that you're putting in place around crisis calls and some of your lessons learned before we get to the new legislation?
Sure. As I mentioned, we're the largest provider of behavioral health services in Eastern Washington. So we have a large array of services, outpatient services, as well as we operate 2 evaluation and treatment facilities for inpatient, voluntary and involuntary treatment. We also we provide crisis response services for Spokane County. And our recent endeavors have been under the True Blood class action lawsuit, where we were able to acquire some funding so that we could create co-deployed teams where our mental health professionals are co-deployed with law enforcement officers. And we currently have 8 teams, 6 of which are with the Spokane Police Department and 2 with the Spokane Sheriff's Office. And we're about to add 3 more teams.
And how are those teams working out?
Great. We could probably double the size of the teams and, be able to manage the number of referrals that are coming to us. In the beginning, it was quite an adjustment for law enforcement to have someone in the car with them at all times. But what we found in very short order was having that teaming of an officer and a mental health professional to respond to behavioral health crises really made a difference in the outcome of those contacts. And now we are at a point where other patrol officers are requesting these teams to respond when there is a behavioral health crisis.
So Representative Goodman, I-940 and that legislation and the rulemaking was obviously a big effort, a lot of work, but clearly by this year, there was a sense that additional legislation was needed from the sponsors and the supporters. Can you kind of set the stage for this legislative session and where that sense was coming from?
Yes, actually, the evolution of this issue and the dynamics of all the interested parties started in 2014. After Ferguson, Missouri, and the killing of Michael Brown and the protests that went on in the streets, and then Eric Garner and so many other incidents around the country. And we had already had the woodcarver killed in Pioneer Square, and Zambrano in Pasco, and so incidents here in Washington State as well. And I held hearings and work sessions in the Public Safety Committee. And I have to say that the police who testified were defensive, at least, and obstructionist, actually, saying, no, there's not a problem, and we make split-second decisions, and if you change the law, it's going to endanger the public. And then we kept at it, and then had a task force in 2016, a comprehensive task force on police use of force, which sort of resulted in a stalemate. And then the community stepped up and got enough signatures, and Leslie Cushman was sort of the brilliant person behind the scenes to draft this initiative that really did change the dynamic. And that brought the parties together because something was going to happen. And we were able to bring the community and law enforcement together to agree on modifications, improvements in the language of Initiative 940. And I think that's something that is most important to me, is that the relationships we established between law enforcement and the communities they serve provided the foundation for further work, which we have now just accomplished. However difficult it was, and there's always disagreement, but those ongoing relationships have been very important. And I thought after the passage of Initiative 940, where we established, the opening for holding police accountable for egregious misconduct, I thought that was it. We did it. And then George Floyd was murdered. And then there were protests in the streets again, nationally, and in our state as well. And what I saw, the dynamic between police and those who were demonstrating in the streets, I thought, oh, we've got more work to do. And there was a lot of unfinished business. And so beginning more than a year ago, last summer, we I reached out to the members of color and the Black members in the House and the Senate, and we formed a sort of ad hoc policing policy leadership team to sort of look at the landscape of issues related to accountability and upholding the profession, transparency for the public and for the media, affirmative duties that we needed to impose on the police, prohibitions on certain police tactics. And it resulted in more than a dozen bills that we enacted this year, really landmark legislation, something that hasn't happened in a generation. And now we're seeing a little bit of discomfort with it, and there might be some adjustment necessary, but it really was a top priority for the legislature to instill social and racial equity in our policies, particularly with regard to the justice system. So it's been a long story, not just this year and not just Initiative 940, but everything that led up to it. And we have more work to do.
And Sonia Joseph, I saw you testify at the legislature on behalf of some of these new bills this spring. What was the kind of the unfinished business, or what were the impacted families seeking? What was most important?
Well, the impacted families were seeking accountability, and Initiative 940 had some gaps in it. And so part of this session that we just passed, these great bills, it was mainly to have accountability and families to be able to seek justice and to be at the table. These new bills open up a lot of doors where impacted families and community are involved in some of the oversight and some of the community panels. And you know, that makes a difference because our voices are being heard and we have direct impact on the shaping these policies and how they'll be implemented.
Great. So yeah, I would like to now kind of look at what we've seen so far. We've had just over a month since some of the legislation took effect, July 25th. And the language in the law in House Bill 1310 says, when possible, an officer shall exhaust de-escalation tactics prior to using physical force. And that can include leaving the area of where they've been called if no threat of imminent harm and there's no crime being committed. There's been a lot of discussion about whether police are responding to certain types of calls in the wake of the legislation. Chief Padilla, do you want to talk a little bit about that and what changes have resulted from it and what hasn't changed?
Sure. I think it's important to note, I think most of South King County, if not all of us, are still very much going to these incidents, these calls for service. So the vast majority of that is occurring. I think where the major difference is, and we've done training on this and provided some initial guidance while policy is being finalized, is that we have really had the officers had to contemplate that imminent threat part of it. And I think that's where most of the questions are coming from as to what does that mean exactly? What is imminent? And I know it talks about means, opportunity, and intent in sections of the law. So officers are there, and the biggest, there are two major concerns from a law enforcement perspective, right? We want to go and provide services and get the person help. We want to make sure we're not violating the intent of the law. So if it says there isn't an imminent threat and there's not, and the person is not willing to take services, our direction is the officer needs to start looking to get out of that situation and leave. Now, I think that's in line with what the law is directing us to do, and we're good with that. Where the issue comes in is that the community may not be as good with that, right? We get a lot of questions as to why aren't you responding, or aren't you staying? How can you leave? There are questions coming about that because I think the community, there's some lag time in getting the information as to how the law's changed, why our response is different, and getting them through part of that. That said, I think we continue to find more creative ways. We're seeing officers spend a lot of time. It's not unusual now in our city. I think this is pretty common, where our officers will spend an hour and a half, 2 hours. I know a situation 2 months ago where our officers spent almost 3 hours trying to get a female in crisis to accept housing and some mental health care. So you're seeing a lot of that, which is creating a new issue a little bit in terms of resources and demand for calls, right? So we're working through that. One of the tricky areas, you guys may have seen some of the media on it, and try as I might, I wanted to make it clear that the new laws did not impact our ability to respond to a suicide. That got very confused, and it's hard to get this depth of conversation in on a soundbite, right? So there are more complicating issues, but in the area where there is someone who may have suicidal issues inside a home, that imminent threat becomes an issue, because it's hard to determine when you can't have that face-to-face discussion on that, right? So there's a lot of complicating things that are falling on. I would say that for the most part, you're seeing the response. You're seeing officers think about more engaging with the crisis co-responder teams, which we have one in South King County. I think the difference is you're starting to see a lot more time at distance and communication, which is also causing some concerns, because sometimes we block traffic to do that. But I think the outcomes are starting to head in the right direction. My hope is that in a few weeks, this will all level out, and we'll be into our groove on these issues.
And yeah, the King 5 story talked about some guidance, and I know you've said you've worked with neighboring agencies as well. So maybe this is guidance that several cities developed together. I'm not sure where it said if a suicidal subject is alone in their residence and doesn't present a threat to anyone else, officers will not respond to the scene. Do you know how that was developed?
Yeah, that's one of those things where I said there's other influences. So one of the biggest influence in that decision, and so we try to reach them remotely, is what it doesn't say in that directive, but that's the protocol. One of the biggest influence in that is recent case law and some lawsuits that law enforcement is losing. The courts have been very consistent in directing that the officers cannot create the circumstance which led to the use of force, and particularly the use of deadly force. So think in situations where we go to these scenarios, and it's very unfortunate, it's tragic, but in a lot of circumstances, someone may be armed, having suicidal tendencies. Officers go, a confrontation ensues, and then a use of force by the law enforcement is deployed to help someone who was in crisis. More and more, when that gets to some kind of legal civil litigation, we are losing in courts significantly so, because the courts are consistently saying you have to consider why you should be there in the first place. This is very, I don't want to sound cold and callous, but it's something that's notable. Suicide is not a crime, right? So we're there completely to try and help someone receive services. And if they're not responsive, we have to be very careful not to escalate things to where force is now used on a person that we're supposedly there to help. It is a difficult situation. Officers also have to be very careful that, and when speaking of the incident that happened on July 25th, when someone is armed with a firearm, we are not going up to the door on that residence for whether it's a crime or not. We're going to try and reach out remotely, put a phone call in, hail via loudspeaker, do what we can, but it's not a good idea, as you can, for obvious reasons, to go right up to a door and try to make contact there. We've had, as you know, we've had incidents where officers have been shot at from inside a home. We've also had incidents where someone who is suicidal decides to go suicide by a police officer, right, to invoke a deadly response. And these are all concerns that weigh heavy on us, and we had to make some hard decisions.
So was this guidance developed in response to 1310, or was this guidance created because, as you mentioned, there's civil liability if your officer intervenes in a suicide?
Yeah, great question. What prompted that document were the new laws. We were trying to give some specific guidance to our service delivery model. And in that, we reaffirmed our prior practice of we're not going to force a confrontation on an armed suicidal person inside a house. We're going to do what we can remotely, but we're not going to force that confrontation.
So that was already a policy in your department before House Bill 1310?
That is correct.
Leslie Cushman, do you want to weigh in on this? Sounds like this conundrum of the civil liability if police go to a call of someone who might be suicidal?
You know, I don't know about that civil liability issue. I would hate to have that be the case, that police are weighing their exposure to civil liability when there's laws passed that address the duty of care and the duty of reasonable care. House Bill 1310 was put in place to address real issues. And House Bill 1054, both of them are addressing a need to reduce violence in policing, and to when 940 put in place and emphasized training, as Monica said, then the next thing was now we have statewide standards that set out the de-escalation standards and proportionality. And when the need for force is gone, then you quit using force. And there was a need for this statewide. There were 300 police departments, all with their own policies. So this issue of civil liability, I want to be respectful of it, but I hope it isn't guiding police department behavior. They need to, there's a duty of reasonable care. They have community caretaking functions, and there is nothing in the law, as the chief knows and has stated, that requires them to refuse service. So what we're seeing is, and I appreciate his response, we know that law enforcement is not the right response for every situation. And I know that Chair Goodman and others at the legislature are working on, they worked on the 988 system. They're working on funding all over the state. And Jan probably knows this more than anyone. We're getting more robust responses and options, because we know that police are not always the right response. You remember the statistics from 940, which are still true today, is that a third of people killed by police are experiencing a mental health crisis. So it's a real situation. There's some real gaps to address here. And I think 1310 is a really good bill, and it addresses the need to de-escalate first. I remember talking to Director Alexander and then Director Rahr when we went over the language of 1310 during session. They said, that's what we're training to. This is what we're doing. I don't know if I can't speak for Monica, but it wasn't a change, and it's what we're seeing in many agencies across the state. So I don't know if I answered your question, but
yeah, I think I did. Okay. Jan Tokumoto, I'd like to go to you and ask, from your perspective, who would be the ideal person to respond if there's an emergency call about someone who may be suicidal? And should they go in person, or is it a response that can happen in other ways?
You know, at this point in time, I think that the ideal response is from a co-deployed team. And the reason why I say that is because you have law enforcement that is there for the safety of everyone. And then you have a mental health professional who can complete an assessment, determine what the level of risk is, and also bring some resources to bear so that we can try to stabilize that situation. What we're finding with 1310 is, I think one of the unintended consequences has been that there are a lot of people that are acutely mentally ill, that are at risk, that we're not able to take into our custody because our designated crisis responders are not able to do that without the assistance of law enforcement. And so we are getting, we have a lot of conversations going on with family members that would like some help, but it's not forthcoming because of certain situations. And we find ourselves in a predicament where sometimes our designated crisis responders are making decisions about, should I go to help this family without law enforcement because law enforcement has not responded before? Or what we're finding is law enforcement and mental health professionals are going out 3, 4, 5 times to see the same person, because we all want to help the individual and do what's best. But sometimes it's taking multiple visits to try to get that person to come along with us, so that there is no use of force or there is no hands-on that is occurring. And to try to affect that when someone is acutely mentally ill and at risk is very challenging.
And do you think, is it a matter of, learning more about 1310, or since Representative Goodman is here, will you be talking to legislators about, do you think a change is needed to allow officers to, be on these calls where people are taken in for involuntary commitment?
Oh, are you asking me?
I'm asking Jan first. Jan,
Yeah.
are you seeking
I can say I've been hearing from the designated crisis responders. I can assure you, yes.
Okay.
Yeah. And I'm hoping that the chief, I'm optimistic in what the chief is saying, that hopefully we'll see things start to level off, and that, we'll see an application of this law that still allows us to get people the help that they need when they're at risk. We certainly, none of us have the workforce to see people multiple times and to place ourselves at risk because of the types of situations and responses that have occurred. The other thing that we're finding is, because of these changes, a lot of mentally ill people are being evicted from housing, and a lot of them are getting arrested. And that is so counterintuitive to what we're trying to do in terms of providing that stability within our community for people who have a mental illness.
What's the link with why are people being evicted related to the laws?
Well, they're decompensating. And so typically in the past, we could have contact with that person and hopefully try to intervene to stop that decompensation process, get them the resources that they need. And sometimes that resource is inpatient psychiatric hospitalization that is involuntary in nature. But because we're not able to affect that, then what happens is that that person continues to decompensate. And then they find that now they have lost their housing.
So now over to Representative Goodman. What's your sense of how things have gone so far since the effective date? And are there changes that you are starting to have in mind that you would be seeking?
2 or 3 things. There are 2 major challenges. First, short term, and second, long term. The first is the legislation we passed, I will acknowledge, was not clear enough in allowing for the use of reasonable force in mental health crisis calls. And so before the legislation, police would put hands on. This is, when we say use of force, it's not violent or hurting anybody. Perhaps it's physically restraining someone or assisting them to go to a secure facility for evaluation. There are other situations where police ought to put hands on someone who, perhaps a juvenile runaway who needs to be brought into protective custody, in abusive households where a court order that the child be removed. The police sometimes need to put hands on, mostly not, but they are usually standing by, and sometimes have to put hands on. Confiscation of weapons at a household subject to a protection order. A courtroom scuffle where the the judge orders that the deputy take somebody into custody, but no crime has been committed. Police, understandably, are hesitant because we were not clear in House Bill 1310. Our intent was clear to reduce the use of force and to reduce violent confrontations. But we didn't make specific reference to those other statutes, which we didn't touch and we didn't amend and we don't want to, in terms of child welfare and involuntary treatment in a mental health crisis. So we do need to adjust that and clarify that. And in the meanwhile, I'm kind of on a tour of the state. I was meeting with Chief Padilla just yesterday in person. I've met with 10 chiefs so far to give them the peace of mind that we're going to make the necessary adjustments. But in the meanwhile, police are not going to get in trouble for doing the right thing, which is to bring someone in crisis into a secure environment and so forth. The second challenge is more long-term, and that is the behavioral health infrastructure that we need to build out, which we neglected for a generation. 4 years ago, we enacted a grant program and appropriated a paltry $2 million statewide to build out these co-responder teams where law enforcement and a mental health professional go out together. It's much better in general for a mental health professional to do the de-escalation where law enforcement stands back. A person in crisis is probably not going to respond as well to someone with a gun and a badge, and will respond better to someone who's trained to do this. But there's not enough of these teams. There's not enough brick and mortar beds for people to get help. There's not enough of the professional workforce of trained mental health professionals. So that's a long-term effort. We appropriated $500 million in this last budget to continue that build out of the behavioral health infrastructure. So that has to happen too. Otherwise, it's sort of cart before the horse. We can pass all the laws we want, but if there's nowhere to bring someone and no one to take care of them, then it's just wishful thinking. So short term, we will amend what we did in 1310 to make it clear that police can continue to do the good work that they've been doing on crisis calls and child removals, juvenile runaways, those situations. And then we will continue to invest in the behavioral health infrastructure.
And since you're talking about some of the fixes, I think I will ask about the conflict in between two of the bills around less lethal ammunition, like the large caliber ammunition that's used in the foam tipped rounds and the beanbag rounds. Is that also,
Yep.
So one bill says they should be used, said less lethal alternatives should be prioritized, I think. And the other bill says these large caliber rounds are banned as military tactics. So what's the fix that you have in mind there, if you do?
Yeah, no, I do have to say that when we were putting all these bills together, first of all, it was a 9-month on-ramp. We started working on this in June of 2020. It was a very deliberate and inclusive process. We consulted with legislators from around the country, with scholars and experts, with community groups, with youth groups, with law enforcement groups. So everybody was at the table. And we've been hearing that, oh, it was rushed and it's poorly written. It's really not true. We passed, again, 12, 13, 14 bills, and we've only identified maybe 3 or 4 issues out of that. So we did a pretty good job, I have to say. And police were at the table. When we were going through this bill, House Bill 1054, related to tactics, as far as chokeholds and use of tear gas and hot pursuits and shooting at moving vehicles and canines, we were dealing with all sorts of tactical questions. And with regard to the 50 caliber shotgun that shoots non-lethal rounds, beanbags and foam bullets, nobody caught it. Nobody pointed it out. And so we missed it, and we're going to have to fix that you can use this 50 caliber weapon, some call it a baton, to shoot non-lethal rounds, which we encourage, of course. I just learned yesterday that the Department of Fish and Wildlife is using 50 caliber weapons to shoot live 50 caliber ammunition. And I thought, well, wait a minute, that sounds illegal. But Department of Fish and Wildlife have to deal with bears, and we never thought of that either, right? So there are some fixes we're going to have to consider. But again, and I probably should yield to Director Alexander about the peace of mind that the Criminal Justice Training Commission can provide to law enforcement now, before we go into the legislative session to make the fix, that if they use the 50 caliber launcher to launch non-lethal, it's not an excessive use of force. It's not wrongdoing. Nobody's going to get in trouble. There's not going to be an investigation. There aren't going to be any sanctions. And I understand that line officers are worried about that, but we're trying to provide them some peace of mind on that.
Director Alexander, what have been the main things that you've been working on at the commission as all this new legislation has taken effect?
So many things, but I want to address Representative Goodman's statement because I think it's really important for people to understand you can't be a peace officer without certification in the state of Washington. And one of the things that we have heard a lot about is police officers being afraid that if they use less lethal for beanbags, they will get decertified for excessive use of force. What I can say to that is because of the conflicts in the bill, the AG would never take that case because there's 1054 that says do not use the 50 caliber, the 1310 that encourages the use of less lethal to take control of a situation. Because of that conflict, I would not move that case forward for excessive use of force, especially if a situation is ended peacefully because of the use of less lethal, opposed to using a firearm that would perhaps take someone's life. So it just doesn't make good sense. And I know Representative Goodman, what he says is true because I know they talked to Sue Rohr quite a bit. I know that there was a lot of conversation prior to session and just that little piece, the caliber piece was missed. And I think it would just not be fair to our law enforcement personnel to decertify them, take away their right to be a police officer when now they've ended a situation peacefully. So I do have the opportunity at CJTC, whether to move a case forward in consultation with the AG, because that's where we pass our cases to once we decide, and then they put the final recommendation on whether or not an officer's case of decertification and to present a statement of charges on that. So there's a lot to it, and I issued a statement about this, and some people said good enough, and some people said not good enough. I say that's about what I can do in my seat. I don't want officers to feel like they have to use lethal force because of the 50 caliber issue. I've talked to Representative Goodman about this and several other representatives, and I feel comfortable where we are at CJTC with making that statement. So that was a big thing because I do know that was very confusing and concerning to officers.
Yeah, thank you for spelling that out on that specific issue. On kind of the broader issue of all this sweeping legislation that passed, a lot of it, you're intimately involved in training the officers in our state to follow it. In general, do you think that we're on the right track in Washington with these new laws, or are you still kind of having a lot of concerns about unintended consequences?
I think that we are on the right track, and I think we're doing a lot of good work. I want to really commend Chief Padilla and the South King County team because they really have wanted to communicate and figure out, how to make this work and what we can do in the meantime until some of those small fixes can be made. But I think I look at it as we're trying to keep everyone safe. And how do we do that? And we do that, we're teaching to 5 overarching principles. And one of those overarching principles is communication. That's one of the things that everybody's saying we need to do more of, right? And do it better. So when we're talking, one of the things I know is you get into a situation and police officers start all yelling commands. We're teaching, have one person yell the command so that people understand what you're saying. People are always afraid when they come in contact. I've never seen anyone when the lights go on behind them say, I'm so excited to get stopped by the police. That's just not how people feel. They feel nervous, they feel uncomfortable. It's kind of our responsibility to try to bring that down a little bit and to slow down and assess the threats, assess the danger. So there's a lot of things that we are teaching that Sue started way back when. I can't take credit for a lot of the things that were already in progress when I came, and then the legislation came along and just kind of puts a lot of this into law. So I think we're on the right track. I like working with the chiefs, the sheriffs, the legislators, specifically the community groups. I like having the community groups at the table so we don't have to backpedal and start over and then start over again. I appreciate the robust conversations. Everybody doesn't have to agree with us. And then we can make tweaks and make things better. And I think at the end, that's all of our goal, is to make things better and safer for all of our communities.
One of the pieces of legislation, we've talked about decertification. It's actually a different bill that, broadens the powers of your agency to decertify an officer. How much is the apprehension of that new penalty playing into the rollout and the implementation of the new use of force and tactics bills across police agencies, would you say?
Well, I think that's part of the concern that we were just talking about with use of force and excessive use of force. That's something that wasn't in legislation before, and it is now for decertification. And being decertified is a big deal to police officers, obviously, because they lose their career, basically. So I think it's a part of it, but I don't want people to think protecting their life or protecting the life of someone else is going to automatically get them decertified. However, the other piece of the training that we talk about quite often, which is slowing the contact down, using only as much force as necessary, the things that we're really trying to instill, because you don't have to run into a situation. And I think Chief Padilla said it a little bit ago, maybe in different words, about creating jeopardy and how that can force, use of force. And I think everyone, police leaders are looking at, how do we make sure that we slow things down and make things safer for the audience and for the officer, for our community members, and for everybody involved. So obviously this is a dangerous job, but I think we're learning that slowing down the process, if and when you can, is going to make it safer for everyone.
Sonia, Joseph, what are you seeing so far in terms of the implementation of the new laws? I think you're muted.
Well, some cities such as Seattle, Bellevue, and many more cities are adjusting to the new policies. And yes, there's some concern from the city of Kent. And as far as implementation, well, it's just the beginning, and with some of the conflicts that South King County, particularly Kent, is having with these policies, it's making it pretty difficult and it's putting lives at risk, particularly the most vulnerable communities. But overall, there are a lot of cities and departments that are embracing the new policies and are ready to put everything into implementation.
Chief Padilla, can I come back to the less lethal, because I know you mentioned your department is continuing to use the, I don't know if it's the beanbag or the 40 millimeter. How did you make that decision to keep using it?
Yeah, real quick to follow on the last, I want to recognize Representative Goodman, because there is strong commitment to address some of the fixes, like you said, and we're looking forward to that. One of the things I want to, I think it's a really good example here in terms of the decertification. By the letter of the law, the 50 caliber issue was a real thing. And so it's automatically looked at from an officer's perspective that if they were to deploy less lethal, that means they're outside of policy, outside of law, which would trigger decertification. The decertification issue is a real issue, because it's not just that, it's also the civil liability that comes with that officers can be held personally liable. And then there's always a looming potential for prosecution if is there suspicion of a criminal investigation, which should be conducted, but these are factors, right? I think what's going to help the officers is when we get to the part, and this is a lot of work that I know Director Alexander is involved in getting to, is they need to know what the rules are. right? They need to know where the boundaries are and how the process is going to go and how hearings are going to look in terms of evidence and how evidence is presented and how it's weighed and how it's considered. They're going to need to see some rulings come out from CJTC that give us their version of what would be case law that says, in this circumstances, these facts occurred, and this was the decision by the commission, so they can see for themselves and be confident moving forward of, okay, we get it now. These are the guidelines that we're being told to and directed to be involved. And I think you'll see the officers adjust to that because we do it every year, or we do it every new case precedent that's come out. And it's just one of those deals where the more confident in feeling where they know where the boundaries are, the more adherent to the rules and more successful they're going to be. So I wanted to close that part out. On the issue of the less lethal, we did take a different stance than some other parts of the state, and that our legal advisors were telling us they're banned. Start packing them up and send them in. You saw a lot of agencies say that. And again, I want to note we're working to get that fixed, and we'll be at the table, and that's probably not going to be an issue too much longer here. We looked at what was important. We looked at what's at the core of what we do, and what at the core of what we do and what we stand for is to protect lives and save people, right? Protect people. And so that was not consistent with what we stood for. We made a conscious decision that we would take on the potential liability of being looked at for using a tool that was banned by the law. So what you had was a group of chiefs in South King who got together and made a leadership decision in the best interest of the community, and also in the best interest of the officers, because one of the things that's not discussed very often is that it is extremely traumatic, regardless of the circumstances, to take someone's life. I will assure you that every officer that I've ever met would much rather not have to do that, would much rather have the tools available to them to use less lethal and help somebody. So it was a combination of our community really needed us to stand tall on this, and we did. And it was also in a consideration for what the impact would be internally. So we'll continue to make those decisions. And I think that's really what we're talking about kind of in a global sense here is when these issues come up, I'm glad that we have the connections and relationships to address them. But they're real issues, and we don't want officers to have to kind of choose between doing the right thing by what they swore an oath to do and then maybe getting in trouble because of a technicality of the law.
And which tactics does your department use? Do you use the beanbag rounds or the 40 millimeter or both or something else?
We moved away from the beanbag rounds, and we now use 40 millimeter, and there's a lot of reasons I could bore you with on that, but we think they're a better option, so we deployed those years ago.
Leslie Cushman, did you want to add something?
I want to respond to a couple of things. First, I want to tell Jan, so this, got notes from a couple questions back that Chair Goodman and Representative Johnson asked the AG's office for advice on the Involuntary Treatment Act and other things. And I believe the guidance from the AG's office, I'm going to lower my hand there so it doesn't confuse people. The AG's memo, which Representative Goodman and Representative Johnson have made public, says that police can detain and transport vulnerable people to facilities under the Involuntary Treatment Act. And so that might address some of the issues, and maybe Chair Goodman can talk about that more. So that's one issue. The AG said the law does not prohibit law enforcement from detaining, and detaining means you touch people, and then transporting, you have to have hands-on to transport under the Involuntary Treatment Act. So they specifically said that. And I want to talk a little bit about the officer-created jeopardy. It is a real issue, and we call that escalation. That's why we want de-escalation. And we see Officer Nelson in Auburn as being charged. And if you look at the charging document, he created the jeopardy by escalating. I believe if you look at the charging document for the death of Manuel Ellis, those officers created the jeopardy. And if you look in the facts and the death of Stonechild Chiefstick, that officer created the jeopardy. So that is an issue. And I also want to let folks know that there isn't any personal liability for police officers. They're indemnified. So, which is a good thing. And we passed an indemnification as the correction in 940. Chair Goodman, remember that was added in 3003 and then 1064. So they're indemnified, and which is a good thing. I am all in favor of that. So just wanted to clarify those things. Thank you for letting me speak.
Sure. Yeah. Representative Goodman, I would like to ask a little bit about the Attorney General's role. Why did the Attorney General have a year to create guidance around some of the new legislation? Some police chiefs have said they would have really appreciated that guidance as they, are putting their own practices in place. And then can you talk about other areas that the AG will be clarifying in an upcoming opinion?
Well, all of this does take time. I don't think the Attorney General could just magically come up with a model policy for the use of force without consulting agencies across the state and seeing how the legislation is being implemented. 1310 does require the Attorney General to establish a model policy for the use of force by the end of 2022. If you look at what the Criminal Justice Training Commission did to come up with the training protocol and with the investigation protocol, that took a while too, and it was on a fast track. So we can't really expect the Attorney General magically to come up with a model policy for the use of force without a lot of consultation. I do think that there's still some confusion about response to mental health crisis calls, because there are two standards that are somewhat inconsistent. The mental health professional will recommend that someone in crisis be detained and brought into custody for, not arrested, but for evaluation, if there is a likelihood of imminent harm. And so it's actually a lower standard. The standard we established in 1310 for police use of force was that they can use force if there's an imminent threat of serious bodily injury. And that's a higher threshold. So there's this inconsistency right now, and we need to rectify that and make sure that what existed before we passed the police accountability legislation will continue in force. In other words, the Involuntary Treatment Act, dealing with what to do with a mental health crisis call, will still apply as it had before. And as I said, we want police to know that they can continue to do the work as they did before, to be able to use reasonable force, perhaps to restrain someone or to put hands on to assist with transport to a secure facility for evaluation, as they did before. But there is a little bit of confusion right now. We're going to have to clear that up.
And Jan, would you like to respond on, is that clarification that you feel like you would need?
I absolutely think that would be very helpful to get that clarification, because I think that law enforcement really wants to help these individuals just like we do. But I think 1310 really kind of confused some of the issues that were present. And my goal is that our community is safe. And when I see that there has been a decrease in the number of involuntary hospitalizations and the number of people that are remaining in our community who are at risk and acutely mentally ill, I have concerns for our community, that there are people that really need some type of assistance and we're not able to get it for them. And therefore our community may not be as safe.
So you'd like to hear the legislature reaffirm that officers can help with these involuntary commitments?
Yes.
And as I said, we also need to do the same thing with regard to removal of children from abusive households where a court has ordered the child to be removed, where police stand by, usually don't have to intervene physically, but sometimes, on rare occasions do. and then juvenile runaways who need to be brought into protective custody. There are circumstances where police need to use reasonable force, and that's the importance of 1310, is we define what force can and should be used and when it should be terminated. Because too often before we enacted this legislation, excessive force was used, resulting in injury and death. And so what we laid out in terms of what use of force means was very important. But in these circumstances of child removals, mental health crisis calls, juvenile runaways, and so forth, we need to be clear that they can continue to do the work they did before.
I have a question, and I'll see who would like to answer it or weigh in on it. So some people at Next Steps Washington and the Fatal Encounters Project have kind of preliminary data, and people who you've all referred to possibly a decrease in deadly encounters with police so far this year. So I think this goes beyond maybe just the stats that they've gathered, but they said it seems that the numbers of deadly encounters have dropped off in Washington this year, not necessarily nationally, in comparison with the last maybe 3 years. So they're just speculating, could the new legislation, be playing a role in that, or maybe, depolicing, officers pulling back and being more cautious is another theory I've heard. Does anyone want to talk about whether they have heard similar numbers and what they think it might mean, or what their questions are about them? Director Alexander, do you have any thoughts about that?
I don't. And I'll tell you why. I think that the chiefs, that's more of kind of their area tracking that. And I don't want to get out of my lane on this.
I sense a little nudge there, so I can jump in.
Thank you.
I think there are probably a combination of things of why you've seen the trend. Definitely the intent of the law has been very well received in terms of our training, our policy, and our shift in culture. So that I do want to give credit there, that I think the laws are helping drive that. I also think there's some other issues that are compounding this. One is there is, because of the uncertainty until the officers get clarity, because the other, let me back up a second. With 13 pieces of legislation passed, let's call it 96% of all of that is good and going. We're really talking about maybe 4 little items. And what we haven't talked about tonight, not little items, but 4 items that need to be clarified. In 1054, there is an issue that officers are, and we're working on this regarding the ability to do an investigative detention based on reasonable suspicion, which was the old standard, to now probable cause. Okay, so what I'm saying is that you are seeing less proactive contacts by police officers right now, because in essence, the officer needs evidence, facts, and circumstances to justify an arrest for a crime if they're going to use any force whatsoever to detain someone for an investigation. So you are seeing a trend in less proactive contacts. You are seeing, it would also be very true to say that there is concern in the ranks of law enforcement as to whether or not there is support for them in terms of being proactive in policing. Is the question they're having is the model to be reactive and deal with real crimes after the fact, right? And so we're working through that. I know there'll be some clarification in the law, but I think it's the combination of things that are having the impact. You can call it depolicing, or you may also call it being a little more restrictive, self-imposed restrictive on what type of activities are we going to engage in as an officer who's at risk for doing the wrong thing if they follow a policy or whatever. So I think that's a real deal, and you're going to see it. At the same time, what's concerning to me is that you're seeing the exact opposite occur in terms of violent crime rates, right? The violent crime, particularly crimes involving the use of firearms, is headed in a very concerning direction. We are approaching, for our city anyway, we're approaching some of the highest numbers we've seen in terms of shootings and homicides. And so that is something that also I think plays into this in terms of we need to look at what are the unintended consequences or outcomes of some of this, right? And I know we're working on it. I want to be fair to the process, but as the chief and being responsible for protecting 132,000 people in my city, those numbers are also concerning, and I am suggesting there is a correlation there.
I have to say before Leslie chimes in that the majority of police agencies that I've been speaking with, very much as Chief Padilla has said, understand the legislature's intent to hold accountable misconduct, to uphold the policing profession, to improve community police relations, to treat all communities equitably. The training, as we said already, the legislation we passed just sort of codifies, reaffirms the training that's already taking place that Director Alexander's in charge of, reaffirms the policies and protocols of most police agencies, sort of best practices, Seattle among them. So we're continuing to move in the right direction, which is what yet one more, that's one reason why we've seen reduced needless violence and use of force. But I do have to mention the pandemic because there's been less public activity and less contact between law enforcement and the public. And so that could be another reason why there have been less violent confrontations. And I also have to mention the pandemic for one of the reasons why violent crime, particularly gun-related crime, has gone up because of the stress, the people living in close quarters, and a lot of disorder created economic problems. So we're even starting to see now a little bit of a decline, this is nationally, in the violent crime trend and gun violence as the pandemic starts to wane, although it's surging again, which is just kind of aggravating me. We could have done this the easy way. But so the pandemic really has had a role here in both isolating people so there's not as much police community interaction, and also creating stresses and disorder that's resulted in violent crime. I will say that the legislation we passed is not a cause of the increase in violent crime. That it was going on a lot before a month ago when the bills went into effect.
Leslie, did you want to chime in?
Yeah, I have a couple of things to say. And thank you, Chair Goodman. I wanted to specifically say that we cannot correlate at all the violent crime data with this legislation. It's a trend we've seen for a while, and Chair Goodman is on national public safety, national conference of state legislators. He's tuned into this, and I agree with him that there's no correlation. I want to tell you a couple of things that are interesting. So we've been doing polling on police accountability and public perceptions of police since around 2016. There maybe 5-6 different polls, and consistently we see two things that are not mutually exclusive. Washington voters support police accountability and support these reforms, and Washington voters support their police. So that's okay. They support their police, but they also support these laws and accountability. So I want you to realize that there were 14 bills passed. And if we had paced ourselves out in this incremental process, it would have taken 14 years to get what we accomplished and what the legislature accomplished in 2021. And I know this might sound harsh, but I think prior to now, we've had a self-regulated profession, and now the law enforcement profession is regulated more strongly by the CJTC through its Rebalance Commission. That is it's 51% community members instead of the other ratios. I also want to remind us why we are here as far as the community came to the table. And I appreciate I got a lot of accolades and recognition, but I didn't do this work. This is huge community work, many, many organizations and people, and we are centered on the families, Sonia Joseph and many, many families. So I appreciate the recognition, but I can't take the credit. It's not, I didn't do the work. We did it as a team. We came to the table to reduce, I'm gonna go quick, to reduce violence. and discriminatory policing. And the statistics have been consistent that Black Americans and Native Americans get stopped at incredibly higher rates. And in Seattle and Spokane, that is true. So east and west, it's not just a Seattle problem. And particularly in Seattle, we see that young people, young adults and youth are almost exclusively Black. So we stepped up to address discriminatory policing using data, and that's why we can stand behind this work. It is based on data and the experiences of impacted people. Thank you.
Director Alexander, I just want to ask you one question, and then we have some questions from the audience that I will bring up. In terms of all this new legislation, what percentage roughly of officers in Washington have been trained in it? I mean, I know that they may have gotten, guidance and memos, but I saw the duty to intervene training being rolled out at the academy for brand new people becoming police officers right now at the very front of their careers, but for officers who are already out in the field, how many of them have had training related to this new legislation, or how long will it take for all of them to be touched by that kind of training?
So that's a loaded question, because currently we have 180 recruits and one COA class at the academy. And like you said, that training is being taught to all of our classes. So that's just the current classes. We're accepting one class per month of 30 students. And so the good news is all of our new police officers are being trained in the ABLE, de-escalation, patrol tactics, all of the things that are happening now. It's really great because our new officers are getting that. Now, it's a whole nother issue when we start talking about training officers that are already on the force, because we don't have as great of access to them because they're working every day, and trying to push that training out is a little bit more difficult. However, we also have to train trainers. So we have to get people other than our TAC officers that are available and trained to train our current police officers. So giving a timeline on how long it's going to take the current officers is a little more difficult, but we really want to have that done as soon as possible. We think the duty to intervene, the patrol tactics, that's the other thing, is the patrol tactics in service. We're training officers that are in the field so they can have regional training, so that everybody doesn't have to come to CJTC. They can set up that regional training in their areas, because we know that how important this training is. And prior to COVID, a lot of our trainers, our advanced trainers from CJTC were going around and doing that training and standing up areas so that they could do the training in their own areas. Unfortunately, COVID slowed that down quite a bit. We're starting to ramp it back up, just like we are our basic training, where we were able to bring our recruits back to the academy. We're still dealing with some COVID issues. As a matter of fact, 2 days ago, we had an exposure, which means that every day right now, one of the classes, and including myself, because I was around that class, and all the instructors, anybody that had contact has to be tested every day for 5 days. So we're experiencing challenges, but we want to keep things moving. We understand the importance of getting everyone trained and getting our agencies what they need and our stakeholders. But we're moving as quickly as we can. I can say that. And we've had a couple of patrol tactic in services come up recently where they're going to be able to take that training back to their agencies. So moving as quickly as we can, but not as quickly as we'd like. How about that?
Amy, can I add to that? Because I want to support what you said. So first off, I'm going to do a shameless plug for CJTC and Director Alexander. And I know Representative Goodman is probably knowing where I'm going to go. They need funding for this, and they need staff, and they need resources. It is a true issue, and has been, that we've struggled to get adequate funding for the basic law enforcement academy, which resulted in us seeing backups of up to 6 months at times to get officers trained and certified, which is a big problem. Okay, so there's my plug. She's got all these new mandates. She has all these new training requirements, and I'm not sure I saw a significant increase in resources for her. So there's that.
We actually did. I want to interrupt. In this year's budget, we appropriated funding for 10 additional classes, really beefing up the the ability for the Criminal Justice Training Commission to do the training in a shorter timeline, which gets them back gets the recruits into their agencies quicker. So we recognize that, and we have stepped up, but not enough. There's always more, but we're going in the right direction.
Right, correct. I forgot that part. You're right, and thank you for that. So in the meantime, what chiefs are doing is they're moving resources to get the training developed. So we are currently moving to have every officer in our department ABLE certified. So that's the active bystander for law enforcement. And the tenets of ABLE, in fact, we've got a class tomorrow. We're getting every officer through. You know, it is really focused on preventing misconduct, avoiding mistakes, and then providing an environment of accountability and an environment for wellness and support for the officers, because we think, well, officers who are emotionally, physically, psychologically well are going to do better and probably follow the rules better than not. We did invest, as Director Alexander said, in getting the trainers done for the patrol procedures tactics course. By the way, to be at the academy as an instructor, that has evolved over the years, but a lot of it is a strong dose of de-escalation, communication, and all the things we've been really pushing. We have invested in internal instructors who will now teach our veteran officers. We've invested and re-upped on Dr. Bryant's, implicit bias training. There's a multitude of things, and if you looked, you could get long lists from chiefs who've gotten out in front of this. We implemented our duty to care and incarceration policy, our duty to intervene, and we implemented those last fall because it didn't take a crystal ball to see where the new changes were coming. And so the ones that were very clear and predictable, we got out in front, and to I-940's credit, that kind of set the roadmap for where we needed to go. So I will say that while there is going to be a lag to get a lot of veteran officers up to speed, particularly those small agencies that don't have the resources that I have, chiefs are working to get that and help partner with CJTC to get it done.
And just one other thing to that point is that we talked to, at WASPIC, we talked to some of those small agencies, and a couple of those agencies wanted to come together and do the training together, because it's difficult for Eastern Washington small agencies to send everyone to CJTC because of coverage. If they don't have a lot of officers, they can't send a lot of officers, and they can't even send a couple. So having that in service at their agency is really going to help us expedite this.
Great, thank you, everyone. I really appreciate the discussion. I'm going to bring in some questions that have been submitted tonight from our viewers. The first one goes to Chief Padilla and asks, can you explain, and this might go back to our discussion about less lethal, can you explain how the Washington City's Insurance Association and your risk manager influence the decisions you make on implementation of these new laws?
So we're not, City of Kent is self-insured, so we're not a part of the acronym, I believe, is WSIA. But we are at the table in terms of hearing the recommendations at the conferences. So we are in touch with that and we pay close attention to it. But the decision making for how to implement this is actually a pretty broad-based conglomeration of stakeholders. We have our legal advisors for all of it, and this is the same, pretty similar for most cities. We have our legal advisors, so the city attorney is involved. We have our HR manager, including our risk managers involved. We have our subject matter experts, depending on what part of law enforcement that the law is touching upon. In Kent, I have a race and equity advisory board, so we have our community stakeholders there. And then we have other related influences. And then you add all that together. I know there was a question in the chat about the influence of the unions. In certain circumstances, not always, but in circumstances, there are required triggers for where bargaining has to be done by law with the unions. So if you start impacting working conditions, pay, things of that nature, there are triggers in the law, labor law, that said you have to sit down with the union, not necessarily to get them to get their sign off on policies and procedures, but to get their sign off on terms of the impact in their working conditions. So all of that comes together. It's not an easy process. The way I do it in Kent is I try to bring all the stakeholders together, have those strong conversations. I also partner at the regional level, the Valley Chiefs are very close knit in terms of connecting on these issues. When long before July 25th, we called regional summits together and got the legal advisors and the chiefs and stakeholders together and really started working at how do we implement what we think were going to be the final drafts of the laws. We did that locally. We did that at the state level. WASPIC held several regional-wide conferences online, and they worked through those issues as well. So getting to the decision point on how to implement it is a lot of stakeholders at the state and regional level before we actually get there. What takes a longer term is the actual writing of policy. So generally directive will come out first because we need something immediate now. As the laws settle in, we learn new things, as modifications are made, then policy gets solidified and put out there. Training is also followed on directives.
Thank you. We have a question for Jan Tokumoto about the co-responder program. Are your staff MSW, Masters in Social Work, I assume? If not, what are their backgrounds? How easy or difficult is it to find staff for these positions?
Right now, I have all master's level clinicians with the exception of one clinician who has a bachelor's degree. We have a workforce shortage throughout the state, so it is very challenging to find people who have the interest and the background and the experience to do this type of work. And it is not the type of work that you learn about when you're in college. So we rely heavily on people's experience, what kinds of positions that they've held before, where they are working with law enforcement, as well as being able to manage a crisis situation.
And can you talk about you mentioned, I think it's called the drop and go stabilization. Can you talk about that?
Frontier Behavioral Health operates a 16-bed stabilization unit. And it's probably been, it was during the time of COVID when things were really pretty challenging. And we wanted to be able to give our co-responder teams a resource where if they felt that somebody needed observation and monitoring and they needed staff to assist with that the co-responder team could call and make a referral and actually transport that person to that unit, drop them off and leave. So that's the drop and go concept. And what that has helped us to do is put those co-responder teams back into service within a matter of 10 minutes or less.
Great. Yeah, I thought that was interesting. This is a question for Leslie and for Representative Goodman. The city of Seattle will be negotiating a new contract with the Seattle Police Officers Guild. I think might even be ongoing or coming up soon next year. What can citizens do to ensure that the city does not bargain away the oversight and accountability measures passed in the last session? Leslie, do you want to go first?
I think they need to be engaged. Because find out who's at the bargaining table, and it's going to be the city council and their labor representatives, and become engaged and write letters, go to meetings, become totally informed. It's a pretty specific question, so it isn't really addressing the state legislative advocacy that I do, but engagement and connections and communication is critical. We're also looking at some issues around statewide standards for police discipline for at some point to bring forward to the legislature, which will address those things in general. And so just engagement and don't let up, do not quit.
Yeah, the legislature was asked this session to sort of solve some of the problems that were created through perhaps insufficient collective bargaining on the local level. And presented a conundrum to us because we believe very strongly in collective bargaining. It's an essential institution in any liberal democracy. And so if we were to limit legislatively statewide the scope of collective bargaining agreements, even only in the police space, so for instance, limit arbitration or prevent certain provisions from being bargained, that would be a bad precedent, just at a time when collective bargaining is seeing an encouraging resurgence nationwide. So we were very hesitant to mess with the collective bargaining process, even only with regard to police. And the other unions who we work closely with were very nervous about this as well. So it really is a local matter. And I think what Leslie said is, as far as Seattle is concerned, whoever the new mayor is and members of the city council, they're going to have to bargain, with, and every contract is different in every jurisdiction. Some provisions are very important or less important, depending on how the negotiation goes. There are concerns, for instance, about provisions in police contracts that after a critical incident, officers are given quite a bit of time before they are interrogated, whereas everybody else on the scene is interrogated right away. And officers have opportunity to look at the body cam footage and maybe think about it a while. There's two ways of looking at that, but that's an example of a provision that maybe should be bargained hard on the Seattle level. But I represent Kirkland, so I'm not going to inject myself into Seattle politics or negotiation with the Seattle Police Officers Guild. But Leslie's right; it really is up to the citizens and the city council and the mayor to do the best job possible of bargaining with the police union.
This question might be suited for Sonia. When cities pay out huge settlements to families without going to court, how does the public get a clear understanding about what has happened? Is there transparency for the general public after a settlement has been reached? Would you like to comment on that?
Well, when you go to mediation, I think there's an agreement of not going to trial, and whatever information is public is available to anyone other than what happened within negotiation.
Great. Chief Padilla, would you like to touch on that?
I can add to that. Sonia's correct. The conundrum, I heard that word used just shortly a while ago, so I'll use it too, is that, in pending litigation, we do not make comment for the most part on the pending litigation. So there's no strong messaging or communication going out prior, right? And then after, if you do reach a settlement, then almost the same rules apply, right? You're not really going to go out and make comment on the issue because it's been mediated, it's been resolved, and it's a respect thing at that point. So you have to rely on media coverage, which sometimes is a little hit and miss. And Sonia is correct. There is public disclosure laws that allow full access for the record now that the case has been adjudicated. So there is a transparency piece to it, but you have to do a little work and you have to make the request.
Sometimes the media coverage is stellar, Kidding. Another question. Several, and this might be for Jan, several on the panel have discussed co-responders, but there are a lot of situations where police just aren't the right first responder and their presence may escalate the crisis. I'm curious why there isn't more emphasis on sending crisis responders with EMTs or firefighters instead of with police, as is done in many places already. And Jan, I know this is something that you already do, right?
Yes, we do. We have a co-responder team with our Spokane Fire Department, and they operate much like our co-responder teams with law enforcement. And in fact, they will at times work together on the same situation. So there's certainly some merit with having co-responders with the Spokane Fire Department as well as with law enforcement. The fire department certainly can address those medical issues that someone may have. And that mental health professional can then look to see if there's something beyond those medical issues that may be behavioral health related.
Wanted to comment on this too. We enacted the 988
Yes.
system this year in the legislature, have invested $90 million to set up a new crisis response line, 988, not 911, but 988, which is a federally authorized system. And we will be able to fund it so that people call 988 for mental health crisis. They won't be put on hold. They won't be given another number. And so that's setting up the new pipeline for direct response by mental health professionals. I have been working with 911 dispatch because they have been not as comfortable dispatching, because they're the ones who have been receiving the 911 calls. They're not as comfortable dispatching just a mental health professional or maybe a mental health professional with a EMT or firefighter, because they don't know the degree of risk. And so they are more comfortable dispatching, in addition, a police officer, either to stand by or maybe to intervene. And so that has to evolve as well. And then there are different models too. Police officers can be dispatched to the scene and realize it's a mental health crisis and then bring a mental health professional to the scene. Or police officers and mental health professionals can spend the whole day and night together going from scene to scene. So there are different sort of protocols for that. But I think I'm trying to remember where this recent media report that about 50% of the calls to police for mental health crisis really did not require police response. And there's a wide range, right? You can have a mom who's concerned about her son, but there's no weapon, or you could have a really acute situation where there is a weapon and there's a potential for injury or death. So it really depends on the call. But I make the distinction between, I mean, we ask the police to solve all of society's problems, mental illness and homelessness and racism and juvenile delinquency. We sort of drop it all off at the jailhouse door. And so we really need to give police a break and have them do the work that they're trained to do, and then have the mental health professionals respond more and more to to the mental health crisis calls. Police, maybe Chief Padilla can correct me, but in general, the two major categories that police are responding to are mental health crisis and domestic violence. And unfortunately, police are going to have to continue to respond to domestic violence calls. That's appropriate. But with regard to mental illness and behavioral health crisis, and remember, it's not just mental illness, but substance use disorder and addiction and overdose and so forth, there could be other professionals more appropriate to be dispatched.
And can I let Jan talk about that? Because aren't you working on some of that kind of diversion from 911 as well?
Yes, we are. Frontier Behavioral Health is one of the three hubs, one of the three 988 hubs in the state of Washington. And we've already started those conversations with 911, with the Spokane Police Department, to take a look at what are those calls that are coming to law enforcement and how can we set up some guidance and criteria for the 911 operators so that when they get a particular type of call and it meets a certain criteria, that call can be safely moved to a mobile response team and not tie up law enforcement in that response if it's not needed.
Great. Chief Padilla, did you want to add to that?
Yeah, and I think it's been well covered. A couple of things that I would add is there are some other circumstances related to the co-responder. So what happens when you have that partnership and that synergy is that officers now, because co-responder resources are very limited. So I think we all agree we need much more, right? Mm-hmm. But when it's 3 o'clock in the morning, the crisis response team isn't on. The officers have the ability to make referrals, right? So maybe they talk to someone today who is on the verge of headed towards a full-blown crisis, right? We've been trained, we're talking to them, maybe we've helped them before. And so now in our system, we can send a referral. I'm pretty sure it's common in other systems to our crisis response teams for follow-up at a later time. And that would not involve law enforcement at all most times. So that's another thing. As we develop 988, one of the things I would throw in there is that it's one of the things that helps reduce the number of calls that law enforcement goes into is the triage point for which it comes in. And the system we have in South King, although again, they're overwhelmed, is that when the call comes in, if there is any clear indication of a safety risk, law enforcement will not be dispatched. It goes to the crisis team. It's only in those situations where we don't know or can't confirm there's a safety issue, or clearly there's a safety issue and that we need to go. So there's that. I mean, and to advocate for the crisis teams, they have a lot at stake too in terms of risk. And so they've got to do that risk analysis on each of the calls coming in. I like the fact that we'll have the 988 system to do that.
This will be the last question we have. Thanks for the thoughtful audience questions, and then I will turn it back over to Heather. But the last question goes to Chief Padilla. They asked, where can we learn more about the civil cases law enforcement officers are facing? I think this might be back to our discussion on the suicide calls, and what you know to be the penalties of those losses. Are they strictly financial or officer discipline?
So I did see that question in the chat, and so I could get some cases cited from our legal department. They have them memorized, of course, and our legal defense advisors. So I'll circle back on that. The penalties range, and I know there was, in regards to 1310, there is built-in language about immunity, and I think as it pertains to that part of the law, there is not full immunity for officers, and I have colleagues who have been held personally liable for bad outcomes in terms of police use of force, and including mental health subjects. So there isn't liability, unlike with the judges, unlike with the prosecutors and defense attorneys. There isn't immunity there. So the consequence can be directly financial towards the officer. And so it's a case by case. Some cities have statutes on the books that indemnify the officer, but there's always the unless, and then fill in the blank, unless it doesn't meet their criteria. So that it's not full immunity and it's not full protection. The other part of it is that if you're looking at a civil lawsuit, what precedes that is a review of whether or not you were within policy or did you violate the law. And if those are issues that are in question, the other possible ramification is the decertification issue, right? So very, very often you'll see both of those go together, I would imagine, going forward. And again, I know Director Alexander is working on some clear cases that are where officers should maybe not even have been in the profession, but at some time those other cases are going to be looked at as well. So it's not just financial, it's their career. And then the worst potential outcome obviously is that they are sentenced to jail if they commit a crime. So
great. Well, I really appreciate the discussion tonight. Thank you so much to everyone for making time for this. And Heather, I'll turn it back to you.
Okay, can everyone hear me this time? Awesome. Oh my goodness, thank you so much to our panelists for coming together and keeping this conversation going. As so many of you said, like, that's the critical piece. We can't just, sort of pat ourselves on the back that we passed a law. It's really about how it's fully implemented, and continuing to engage all of the stakeholders so that we see progress and we don't lose our momentum. So thank you so much for taking extra time to field our audience questions tonight. Amy, thank you so much for moderating. You did an awesome job and covered so much. I also want to just say to folks in the audience, if you are interested in learning more about the League of Women Voters, we're a nonprofit, nonpartisan, grassroots organization. I've included a lot of information in the chat. You can join us and become a member. We always love donations. It keeps these programs going. And you can help plan forums like this one. I want to say thanks to our forum planning team, Mary Taylor, Barbara Tengio, Adele Reynolds, Sonatina Sanchez, Deb Karstens, Julie Sarkisian. It really is a team effort, and and we're a really fun community to join. So anyway, I think that is it. Thanks to all of you for coming, and yeah, enjoy the rest of your night.
Thanks, everyone.
Thank you
Bye-bye.
very much.
Bye.